Addison's disease. Addison's illness, additionally called adrenal inadequacy, is an extraordinary problem that happens when your body doesn't create enough specific chemicals. In Addison's disease, your adrenal organs, found simply over your kidneys, produce too little cortisol and, frequently, too little aldosterone. Addison's illness happens in all age gatherings and both genders and can be perilous. Treatment includes taking chemicals to supplant those that are absent. Manifestations. Addison's illness manifestations ordinarily grow gradually, regularly more than a while. Regularly, the sickness advances so gradually that side effects are disregarded until pressure, like a disease or injury, happens and aggravates indications. Signs and side effects may include outrageous weakness, weight reduction and diminished craving, obscuring of your skin, hyperpigmentation, low circulatory strain, in any event, swooning, salt wanting, low glucose, hypoglycemia, queasiness, looseness of the bowels, or spewing, gastrointestinal manifestations, stomach pain, muscle or joint pain, crabbiness, discouragement or other social manifestations, body balding or sexual brokenness in ladies, intense adrenal disappointment, Addisonian emergency. In some cases, the signs and manifestations of Addison's infection may show up abruptly. Intense adrenal disappointment, Addisonian emergency, can prompt hazardous stun. Look for crisis clinical treatment in the event that you experience the accompanying signs and indications. Extreme shortcoming, disarray, agony in your lower back or legs, extreme stomach torment, regurgitating, and looseness of the bowels, prompting lack of hydration, decreased cognizance of ridiculousness. In an Addisonian emergency you will likewise have low pulse, high potassium, hyperkalemia, and low sodium, hyponatremia. When to see a specialist. See your primary care physician on the off chance that you have normal signs and side effects of Addison's illness, for example, obscuring spaces of skin, hyperpigmentation, extreme exhaustion, accidental weight reduction, gastrointestinal issues like sickness, spewing, and stomach torment, dizziness or swooning, salt desires, muscle or joint torments. Causes. Addison's sickness is brought about by harm to your adrenal organs, bringing about insufficient of chemical cortisol and, regularly, insufficient aldosterone-2. Your adrenal organs are important for your endocrine framework. They produce chemicals that offer guidelines to basically every organ and tissue in your body. Your adrenal organs are made out of two areas. The inside, medulla, produces adrenaline-like chemicals. The external layer, cortex, delivers a gathering of chemicals called corticosteroids. Corticosteroids include glucocorticoids. These chemicals, which incorporate cortisol, impact your body's capacity to change over food into energy, assume a part in your safe framework's provocative reaction and assist your body with reacting pressure. Mineralocorticoids. These chemicals, which incorporate aldosterone, keep up your body's equilibrium of sodium and potassium to keep your circulatory strain ordinary. Androgens. These male sex chemicals are delivered in limited quantities by the adrenal organs in the two people. They cause sexual improvement in men, and impact bulk, sex drive, moxie, and a feeling of prosperity in the two people. Essential adrenal inadequacy. At the point when the cortex is harmed and doesn't create enough adrenocortical chemicals, the condition is called the essential adrenal deficiency. This is most normally the consequence of the body assaulting itself, immune system sickness. For obscure reasons, your insusceptible framework sees the adrenal cortex as unfamiliar, something to assault and obliterate. Individuals with Addison's illness are almost certain than others to have another immune system sickness too. Different reasons for adrenal organ disappointment may include tuberculosis, different contaminations of the adrenal organs, spread of disease to the adrenal organs, seeping into the adrenal organs. For this situation, you may have an Addisonian emergency with no past side effects. Optional adrenal deficiency. The pituitary organ makes a chemical called adrenocorticotropic chemical, ACTH. ACTH thus invigorates the adrenal cortex to create its chemicals. Favorable pituitary tumors, aggravation, and earlier pituitary medical procedures are regular reasons for not delivering sufficient pituitary chemicals. Too little ACTH can prompt excessively little of the glucocorticoids and androgens regularly delivered by your adrenal organs, despite the fact that your adrenal organs themselves aren't harmed. This is called auxiliary adrenal inadequacy. Mineralocorticoid creation isn't influenced by too little ACTH. Most manifestations of optional adrenal deficiency are like those of essential adrenal inadequacy. Notwithstanding, individuals with auxiliary adrenal inadequacy don't have hyperpigmentation and are less inclined to have serious parchedness or low circulatory strain. They're bound to have low glucose. A brief reason for optional adrenal inadequacy happens when individuals who take corticosteroids, for instance, prednisone, to treat persistent conditions, like asthma or joint pain, quit taking the corticosteroids at the same time as opposed to easing off. Inconveniences. Addisonian Emergency. In the event that you have untreated Addison's sickness, you may create an Addisonian emergency because of actual pressure, like a physical issue, disease, or ailment. Ordinarily, the adrenal organs produce a few times the standard measure of cortisol because of actual pressure. With adrenal inadequacy, the powerlessness to build cortisol creation with stress can prompt an Addisonian emergency. An Addisonian emergency is a perilous circumstance that results in low circulatory strain, low blood levels of sugar, and high blood levels of potassium. You will require prompt clinical consideration. Individuals with Addison's illness generally have related immune system infections. Avoidance. Addison's infection can't be forestalled, yet there are steps you can take to stay away from an Addisonian emergency. Converse with your PCP on the off chance that you generally feel drained, feeble, or are getting thinner. Get some information about having an adrenal deficiency. In the event that you have been determined to have Addison's sickness, get some information about what to do when you're debilitated. You may have to figure out how to expand your portion of corticosteroids. On the off chance that you become debilitated, particularly on the off chance that you are retching and you can't take your drug, go to the trauma center. A few groups with Addison's sickness stress over genuine results from hydrocortisone or prednisone since they know these happen in individuals who take these steroids for different reasons. In any case, in the event that you have Addison's sickness, the antagonistic impacts of high-portion glucocorticoids ought not to happen, since the portion you are endorsed is supplanting the sum that is absent. Make a point to circle back to your primary care physician consistently to ensure your portion isn't excessively high.